Good afternoon, Year 10. I'm going to go through Module 2 for the next 10 minutes, which is Health and Disease. Okay, the first thing we did was look at microorganisms. Remember, there's no such thing as a germ. It doesn't exist. They're called microorganisms, and there's a number of different types. The three main, most common ones are bacteria, viruses, and fungi. Now, you need to know the names of just one or two, and I'll mention them as we go through. Now remember, these microorganisms can reproduce very, very, very quickly. Bacteria in particular can reproduce in 20 minutes. So for instance, if you start off with one bacteria, 20 minutes later you'll have 2. 20 minutes after that you'll have 4, then 8, then 16, and so on and so on and so on. So very quickly they can reproduce. Now the symptoms of these diseases are caused by the toxins or the poisons that these microorganisms produce. So often it's not the microorganism itself in your body which causes the disease, it's actually the toxin that they release. Now, how do they get into our body? Well, usually they go in through an orifice. There is a hole or through the skin. So up through your nose, and your mouth, up your bum, or through a little pore in your skin. We have natural barriers to reduce the risk of these microorganisms entering our body. The main ones you need to know about are the skin. Now, if you think about it, the skin forms a constant layer all around your body to stop microbes getting in. The only way they can get through is if you get a cut. The other way they can get through is, of course, through the mouth. Now, in your stomach, you have a very, very strong acid, which has a pH of about 1, and this will kill most bacteria entering your stomach. You've also got sweat, which is very, very salty, and tears, which have an enzyme in them, which help prevent bacteria and other microorganisms entering your body. Now, let's say, for instance, that one of them does get into our body. We then have to move on to the second line of defense. Inside your body, you have white blood cells called phagocytes and lymphocytes. The phagocytes are a bit like Pac-Man. If you remember, they go around and they engulf, which means surround, and then eat microorganisms. They digest them using enzymes. So they're called phagocytes. The second type of white blood cell, called a lymphocyte, what it does is release antibodies. Now, here's the important bit. Remember, an antibody is a chemical which is produced by a white blood cell. Now, these antibodies have special shapes. Every single microorganism which enters your body has special chemicals on its surface called antigens. Now, what the antibody can do is actually fit into the antigen. So each microorganism has a different shaped antigen. The white blood cell will produce an antibody of the same shape as the antigen. The antibody can then either bind to the microorganism or it can destroy it itself. So there's two things it does. It binds, it clumps them together, or it will actually destroy it. Okay, now, based on this principle, some lunatic about 150 years ago developed vaccines. His name was Edward Jenner. And the principle of a vaccine is this. If you had something such as meningitis, now the time it takes your body to produce sufficient antibodies to destroy the meningitis, this would be about 3 or 4 days. Now in this time you're probably going to die because it's such a virulent disease. So what you can do is have a vaccination. A vaccination works by introducing a dead, sometimes called attenuated, strand of the virus into your body. Once it's inside your body, your white blood cells then recognize it and produce antibodies. Once the antibodies have been made, the white blood cells also produce memory cells. Now, these memory cells stay in your bloodstream. So let's say, for instance, 3 years later, you now actually get the real meningitis disease. Once the meningitis gets into your body, your white blood cells will recognize it and produce antibodies very, very quickly and rapidly, which means they can destroy the disease before it has a chance to cause harm. And that is the principle of vaccination. Now, if a vaccine is going to work, then it's very, very important you have a vaccination policy. This means you would have to vaccinate the vast majority of the population. So, for instance, the MMR vaccine is one we have in this country, when everybody gets vaccinated against measles, mumps and rubella. If you have a few people who are not vaccinated against, what will happen is those people can then spread the disease to others. So it is very important in a vaccination policy that everybody is vaccinated at the same time. Now, some people disagree with this, of course, because they think it impinges upon their human rights as a person to decide. But if not enough people don't get the vaccine, then what you're going to have is the vaccine will be no use whatsoever, because it will be spread by those who don't have the vaccine. There are other issues about vaccinations, such as a vaccination for influenza, that's flu, and also trying to get a vaccine for HIV. You can't get a suitable vaccination for flu, colds or HIV because they're caused by viruses, and what these viruses do is mutate. That means change very, very quickly. So the antigens on their surface will change shape. This means the old vaccine with a certain shaped antibody won't fit anymore. So for HIV, it's almost impossible to come up with a vaccine. For something such as flu, what they have to do is keep on giving vaccine maybe every single year, and they give a new flu jab to counter the current flu virus which is out. Okay, now another way we can fight disease is not by using vaccines, but by using antibiotics. Now it's very important to understand antibiotics only work on one type of microorganism, and that is bacteria. Antibiotics do not work on viruses. This is because an antibiotic is a chemical which is released by fungi and some bacteria, and what this chemical does is cause the bacteria to burst. The cell wall gets very, very thin and it bursts. Okay, so antibiotics are used to counter bacteria. Now, there's a problem in recent years because what is happening is bacteria are becoming resistant to antibiotics. This is because bacteria, again, can mutate very, very, very fast, and random changes or mutations in the genes of these bacteria will cause them to become less affected or completely unaffected by the antibiotic, which means we have to use another one. At the moment, there's only about 1 or 2 antibiotics which can currently work on all types of bacteria. MRSA, of course, is a prime example of a bacteria which has become resistant to antibiotics. Moving on from there, we looked at drug testing. Now, remember, when they do a drug test, they have to use a number of principles. One of them is a placebo. A placebo, remember, is a fake drug or a fake tablet, which is given to compare the real tablet to a fake one, rather than people start to make up symptoms which weren't really there in the first place. The other 2 types of principles you need to know about in drug testing are blind trials and double-blind trials. Now, a blind trial is where the patient doesn't know what type of drug he's been given. A double-blind trial is where the patient doesn't know what he's been given, and also the doctor who hands out the tablets has no idea what he's given them as well. This is to stop bias from the doctor, because sometimes, of course, if a doctor's been working on a cure for many, many years, he wants to make sure that his drugs actually work, which means he might bias the results. So, when they do the test, they don't tell the doctor or the patient about that. Moving on from there, we looked at heart disease. Now, heart disease, remember, the heart, although it pumps blood, it has to have its own blood supply itself, otherwise it'll stop contracting. It needs to be supplied constantly with glucose and oxygen. It gets this supply through an artery called the coronary artery. The coronary artery runs on the outside of the heart. If you have a coronary attack or a heart attack, what happens is this artery becomes blocked. If it becomes blocked, there's no oxygen and glucose reaching the heart muscle. This will lead to that area of the muscle not working, it will stop working, and then you have a heart attack. Now, heart attacks can be caused by a number of different factors, and I'm just going to list a few of them. Genetic factors is very important, i.e., if you have a history of heart disease in your family, there is a higher probability that you may contract heart disease. Poor diet, eating donuts and crisps and crappy pizzas, isn't going to help either. Stress, cigarette smoking, and drinking too much. Okay, so these types of factors are going to increase the chance of heart disease. Moderate exercise is going to decrease the risk of heart disease. Moving on from there, we looked at epidemiological studies. Remember that big long word? Basically, an epidemiological study is a big study done on a lot of people over a long period of time. So for instance, does smoking cause lung cancer? Does drinking cause cirrhosis of the liver? These would be examples of epidemiological studies. These provide evidence for a cause rather than just looking at things which might have caused it. They're very, 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 very complex and take a long time. They are based on things such as the sample sizes being very large. Remember I said for an epidemiological study you have to have a sample size of well over 1,000. And everything else has to be taken into consideration, such as, are the people of the same gender? Are they the same age? Do they have the same lifestyle? Etc, etc, etc. So in short, epidemiological studies are very hard to carry out. In the examinations, you will probably be asked to critique or analyze one of these studies. Okay guys, I think that is it for Module 2. Good luck.